Good morning. On behalf of the Border Solutions Alliance and the West Big Data Hub, thank you for joining us today for our lightning talk with Ilya Zaslavsky, Director of the Spatial Information Systems Laboratory at the San Diego Supercomputer Center at UC San Diego. This morning, Ilya will spend about 15 minutes providing us an overview of selected projects, dashboards, and data sets related to COVID-19 spatial analysis and modeling in San Diego. We'll then have some time for questions and answers. Ilya, I'll go ahead and turn the floor over to you.
Thank you, Melissa, and thanks for this opportunity to give a talk to this group. Chances are that when you work on the data challenge, you will work with spatial data, with location data for Mexico, for the United States, by zip codes, by census tracts, and similar units. And it would be important to understand some techniques and tools, and perhaps you're familiar already with some techniques that deal with spatial data. I will give several examples of data science projects in the realm of spatial data science. This is basically when we look at spatial relationships, locations in space, as a way to gain insights and improve models that we develop. And this is a fairly new field, includes a combination of geography, GIS, and data science, statistics. And before we dive into that, I will give you one slide about what my group is doing. We've been mostly working on spatial data integration, interoperability between different types of data and data located at different places and organized by different researchers, spatial databases, online analysis systems, and information discovery. Some of the bigger projects are EarthCube, very large-scale hydrologic information system project that was the largest in the world, I guess, and developed services for integrating data across multiple sources of hydrologic data, and a few others, including our extensions to neuroscience, where we use GIS to model the brain. I also teach in the data science program at UCSD, and my classes are on spatial data science. And the last quarter, in spring, I also taught fighting COVID with data science, and then the students from that course later continued to independent study with me. So I'm going to show some examples of projects from these classes, because it's likely that you will be doing something similar, or you will be trying to extend something that has been developed, or just get some ideas of the types of projects that have been done by students. So the first one is, and you heard Peter's talk right before, where Peter and I work on knowledge graph. One way to query knowledge graphs is via dashboards. I'm going to show you one such dashboard, which actually just won first place in the EURISA competition last week, and mostly developed by a student. So here what you have is zip codes in San Diego, and you can zoom into any area here and or to any zip code and get information about what happened here in terms of number of COVID cases over the entire period of observations, or just in the last week. For each of the zip codes, you can get information about the age structure in that zip code, several social economic indicators and health indicators such as diabetes, obesity, heart disease prevalence, and so on. And so you see, when I click on any of the items here, the maps get repositioned and all the charts are updated. And I can also do the same from the map. So if I select a zip code, let's say near the border with Mexico, you will get updated information about characteristics in that area. The interesting part of that dashboard is not just that it gives you the current situation, it also tries to do forecasts. And so this map on the right shows you what we have forecasted, or I should say, students have forecasted using a so-called ARIMA model, and that's a moving average type model. So where values actually get adjusted based on moving average values get adjusted based on a range of age, social, economic, and health indicators. It was interesting that we ran this model several times, and it gives forecasts 30 days out. The last forecast actually overestimated the number of cases, because overall in the country, after the surge in the previous months, after July 4th weekend and Memorial Day weekend, when we had fairly extensive surges in the number of cases, people got scared a little bit and started to follow social distancing and other types of rules, such as wearing masks, and as a result, the cases went down. So I guess what we found is that it's very important to look at the trends when people get scared of the number of cases that they see across the country and across the county, and then eventually they sort of get used to that and start going out, and then the numbers go up. And these type of influences seem to be even stronger than local influences from, based on the number of people who have high potential comorbidity factors, or those who happen to be in service occupations or sales occupations or similar type of activities where they have to interact with other folks, and certainly have to become more vulnerable. So one idea would be to extend this to Mexico, and all of the services behind this dashboard are open, and if you, as part of your data challenge, set up similar services for Mexico, we can try to integrate these to different data streams and see how COVID infection in Tijuana, for example, relates to COVID infection in San Diego. Ideally, for that, you would need information about traffic flows from Mexico to San Diego. And another student actually worked on that application. I will now switch to this view, which gives you locations of, destinations of all trips that originated from two border crossing points at Otay Mesa and San Isidro. And so, for example, here I would click to show trips of particular type. So these are trips to visit, perhaps relatives or friends, work trips, and you see they're shown in different, they will be shown in different color once the map updates. What is shown here with color is the number of people or number of trips that end up in each area in San Diego, originating from, San Isidro and Otay Mesa. These data are by very small units called MGRAs. These are units of modeling used by San Diego Association of Governments when they developed their transportation models. So this kind of data, this is, by the way, pre-COVID type view. And we know that we had about 100,000 border crossings per day pre-COVID, but these days, then it fell to 50%. I believe now it's up to 80% of what was before. And chances are that spatial pattern or the destinations that where people go to from Mexico remain the same. Another dashboard application, and this is where you also can get a lot of data for your projects, is kind of this started as a toy project initially, but now it's a fairly popular system where you can develop your own applications that can be collections of images or opinion surveys or maps like that. And this is, for example, data by census tracts that reflect various risk factors for COVID. So, for example, I would look at percentage of people with no health insurance, and let's look at those areas that have a high percent of these folks, and add some health indicators, such as looking at areas with high proportion of people with heart disease and with diabetes. So what happens is that by moving the sliders, I can zero in on certain areas that are problematic on more than one factor. And this makes it very easy to do that. Now, for any of these census tracts, I can also get information, whatever is available for these census tracts on the right. And more than that, I can launch Jupyter notebooks directly from here. So let's go to, for example, UCSD Data Hub server. And here is I'm launching a notebook. What is interesting here is that I can pass information from the survey to this notebook, so that you can convert this to Python variables and then use them any way you want. So, for example, here I pass this information onto the first notebook, which lets me select what I want to do here. And I can do some arithmetic operations, descriptive stats, named entity recognition. Those of you who deal with text analytics are familiar with that. Or I can even query knowledge graph, and this would go into the notebooks that Peter showed in the last talk. So how this works, just as a very quick example, I open another notebook that does that specific operation and see that I'm not even changing anything in the code. If you want to change the code, you're welcome to do that. But what it asks me here is to select variables that I want to use to construct another variable. So, for example, I do something perhaps totally unnecessary, divide heart disease by diabetes. It computes the new variable, asks me to give a name to the survey, creates a survey where this additional variable will be included. So essentially, we use Jupyter notebooks as a sort of detour from your regular work with an application, and that's, by the way, heart disease divided by diabetes, shown on the map. In the same fashion, you can build dashboards, you can build workbenches, and populate them with your own notebooks. And the last but not the least, I think I have like 1 minute, maybe 2. I will show you. I'll get back to the slides. And by the way, I will share the slides because the slides have links to all the applications that I showed. Yeah, the system that I showed before is called SWAF, Survey Analysis for Visual Exploration. So something that actually is not even yet hot off the press, because the main demonstration of this application will be later today to San Diego Health and Human Services, where we tried to develop a model that combines GIS and agent-based modeling to model transmission of COVID in schools. And of course, schools are opening. That creates major headaches for everybody, because there's very little information of what may happen and how COVID-19 is going to spread if there are like a few asymptomatic or low symptomatic kids in school. So I will run a simulation here, and that will just take 1 minute. You see that this is a layout of a real school. I cannot tell you which one. And we simulate activities such as kids being in the classroom, going to cafeteria for lunch, taking recess time, and if students come within 3 feet from each other and spend some prolonged time together, and one of them has the virus, then chances are that another student will get exposed. So we can show that after 2 weeks, or after 16 days in this case, we have a large portion of the school infected if there are no protective measures. What was interesting here is that we can pinpoint, since these are real floor plans that we digitized, we can pinpoint which areas happen to be the most risky areas for transmission. In this case, this is the cafeteria. So I'm out of time, but these are just some applications that you can develop with using spatial data science arsenal, and I hope you will do something like that. Again, I'll be happy to help through office hours. And this is, by the way, a chart that shows what will happen in a scenario where we do not do anything, that's the red line, versus when students are asked to wear masks and lunches are served in class rather than in cafeteria. Questions?
Thank you very much, Ilya. For all of the folks who are joining us, we have the Q&A function at the bottom of your Zoom screen, and you can use that to ask questions, and then I can also pass the microphone over to you if you'd like to ask them out loud. Ilya, can you see the questions as well? So the first question is, do you have a way to measure the cases of COVID through hospital information? How do you handle missing data when you don't know about cases or people don't report it? What can you do data-wise to deal with the uncertainties caused by missing data?
A very good question, and that kind of goes to the heart of the problem, because what we normally work with is case counts that are reported based on testing. Testing, of course, there have been waves of availability of testing, and it's highly unpredictable to which groups and how it will be administered. So certainly lots of people fall through the cracks and are not reported. Not to mention that CDC guidelines specify who should be and who should not be tested, even if you have been exposed, and if you show symptoms and have been exposed, and it's very likely that you have COVID, then perhaps there's no reason to test you again, and then you're not showing up in statistics. From hospitals, we get data on hospitalization, ICU use, and morbidities, and these data are perhaps more reliable than number of cases, but this data come with a lag, especially data about deaths. So there are lots of issues of how you organize and massage data. It's a very big question. Essentially, it would be important to model the real number of infected people rather than what is reported by case counts, and then use that to forecast hospitalization and ICU use and morbidities and recovery. There are so-called SEIR models that do that. So I'll be happy to talk for another several hours about that, but let's move on to the next question. How is destination data gathered when visiting US destination from a port of entry? What I showed are results of a transportation model. So what would happen with a kind of computed synthetic population given and these models are based on transportation surveys, where occasionally people are asked where they're going, and that is entered into a model that would then imply data from surveys to a population that is estimated for each MGRA. So destination data is, so based on surveys and then used in a larger model. How does the simulation determine how COVID is transferred between individuals? Is it guaranteed based on proximity, or is it random at all? Good question. So there are multiple ways of transmitting of COVID-19 transmission. Droplets, aerosols, which are, you can slow this transmission when you use PPEs. You can slow that when you do regular ventilation of rooms, but we can only model based on what is in the literature, and the literature says that if you happen to be in for a sufficiently long period of time around a patient that sheds virus, then you're likely to get it. It's estimated that among elementary school kids and the transmission is fairly low between them. It's more likely that teachers will actually get infected than kids, and there are huge differences between elementary school teachers' likelihood to get infected and high and middle school teachers likely to get infected. I believe for high schools, if it's around 40%. In one of the papers for middle school, for elementary school, it's like 4%. So it's a drastic difference. Nothing is guaranteed, because it all, much depends on whether you are predisposed based on other health conditions, and then your specific situations. What we can do, we can only simulate and give some average numbers. All models, of course, are models. Thank you. That was a good question, and that would require me to go through, again, an hour-long presentation to answer that. But there are lots of issues with trying to determine which specific non-pharmaceutical interventions, or NPIs, would lead to reduced transmission rate.
Thank you very much, Ilya, for your presentation this morning. We'll let everyone know when your office hours are scheduled, and now we'll end our talk here to go to our third talk of the morning. Thank you very much, everyone.
Thanks. Bye-bye.